Stress. Two short words, but carrying so much weight in modern life. Amid the hustle and bustle, it seems everyone has at least once felt their heart race when facing work pressure, financial worries, unavoidable conflicts in relationships, or even sudden unexpected events. However, perhaps not many realize that these hidden emotional waves are silent enemies, quietly eroding the health of the heart, the most important organ of the body. Stress, also known as tension, is not a disease, but a natural reaction of the body to help us adapt and cope with situations that are perceived as threatening or beyond our control. When you feel cornered, anxious, or afraid, the brain sends signals to activate the sympathetic nervous system, the fight or flight system that has existed since ancient times. Immediately, the adrenal glands begin to produce two main hormones, adrenaline and cortisol. These substances, like an instant doping dose, make your heart beat faster, blood pressure rise, blood vessels constrict, and blood sugar levels spike, all to prepare the body for a fight or flight from danger. If stress only occurs for a short time, for example when you are running away from a fierce dog, or feeling anxious before an important exam, the body will quickly return to a balanced state afterward. But the real problem arises when stress becomes an inseparable part of life, lingering quietly day after day, month after month. That is when stress becomes chronic, and your heart begins to suffer damage that cannot be seen with the naked eye. Imagine if every day you had to work under high pressure, constantly facing deadlines with endless worries about finances, children, and family. How long could your heart endure? When the fight or flight state lasts too long, the heart rate continuously rises, blood pressure is pushed to dangerous levels, and the blood vessel walls gradually become damaged. At this point, bad cholesterol molecules, LDL, easily stick to cracks in the vessel walls, forming plaques, the seeds of future angina and heart attacks. Not only that, the cortisol hormone produced by chronic stress also causes blood sugar and fat levels to rise. For the cardiovascular system, this is a real storm. High blood sugar and fat not only create conditions for plaque to accumulate in the arteries, but also gradually weaken the endothelial cells, the armor protecting the inside of blood vessels. As a result, the arteries become hardened, lose elasticity, and are prone to blockage, leading to dangerous complications such as heart attacks and strokes. Stress can also cause arrhythmia, a condition where the heart beats irregularly, sometimes fast, sometimes slow, causing blood to be pumped inefficiently to nourish the body. Many people, when experiencing a major emotional shock, such as the loss of a loved one, losing a job, or being betrayed in love, suddenly experience chest pain, shortness of breath, irregular heartbeat, and even fainting. In medicine, a special syndrome called Takotsubo, also known as broken heart syndrome, has been recorded. When severely emotionally shocked, the heart muscle suddenly becomes partially paralyzed, and the shape of the heart swells like a Japanese octopus trap. Even without coronary artery blockage, patients can experience severe chest pain, as if they were having a real heart attack. The effects of stress on the cardiovascular system do not stop at the biological level. Stress also makes us prone to bad habits: smoking, drinking alcohol, unhealthy eating, lack of exercise, and prolonged insomnia. All of these are powerful catalysts for the development of cardiovascular diseases. Just ask those who often have to work night shifts, businessmen with busy schedules, or single mothers who have to work while taking care of young children. How many of them maintain a regular lifestyle, eat healthily, and get enough sleep? This disrupted lifestyle only further exhausts the heart. Not only adults, but even young people cannot escape the ghost of stress. Nowadays, the rate of students suffering from cardiovascular diseases due to academic pressure, exams, and family expectations is increasing. Symptoms such as palpitations, nervousness, mild chest pain, shortness of breath, insomnia, prolonged fatigue may seem like minor disorders, but if not detected and controlled in time, they can completely develop into serious long-term diseases. So how can you recognize if your heart is being robbed of health by stress? Pay attention to warning signs such as an abnormally fast heartbeat without physical activity, irregular blood pressure fluctuations, chest pain, shortness of breath, prolonged unexplained fatigue, palpitations, nervousness, cold sweats, prolonged insomnia accompanied by negative emotions. If you notice these symptoms, do not be subjective. It could be a silent cry for help from your heart. To protect your cardiovascular system from the effects of stress, the first important thing is to build a healthy lifestyle for yourself. Start by maintaining regular physical activity. Just 30 minutes of brisk walking, yoga, cycling, or swimming each day is enough to help the body produce endorphins, the happiness hormone, which helps reduce stress, improve blood circulation, and keep the heart healthy. Additionally, learn to control your breathing with techniques such as deep breathing, meditation, and yoga nidra. Many studies have shown that just 10 to 15 minutes of meditation each day significantly reduces blood cortisol levels, stabilizes heart rate and blood pressure. An equally important factor is maintaining a regular daily routine, getting 7 to 8 hours of sleep each night, eating meals on time, limiting work at night, and not skipping breakfast. Don't forget to say no to bad habits such as smoking, drinking alcohol, overusing coffee, fast food, or eating too much salt. Things that seem to help you relieve stress temporarily are actually a long-term burden on the cardiovascular system. And most importantly, don't hesitate to seek support when feeling overwhelmed. Confiding in family, friends, or consulting a mental health professional is an effective way to relieve negative emotions. It's time for us to recognize that mental health is just as important as physical health, because a peaceful mind is a solid foundation for a healthy heart. Real-life stories further highlight the dangers of stress to cardiovascular health. In 2012, a Harvard University study showed that people who experienced severe psychological trauma had a 21 times higher risk of having a heart attack within the following week compared to normal individuals. In Japan, the phenomenon of karoshi, death from overwork, has become a social issue. Many young people, after working 16 hours a day for a long period without rest, have suddenly died from heart attacks or strokes. Looking back, we realize that the heart is not an eternal machine that can withstand infinite pressure. It also needs rest, care through a healthy lifestyle, love, and sharing. Don't wait until you clearly feel irregular heartbeat, soaring blood pressure, or chest pain to start caring about cardiovascular health. Consider managing stress, physical exercise, and psychological care not just as choices, but as responsibilities each person has towards themselves and their loved ones. Life will always have pressures and unforeseen events, but as long as you know how to listen to your body, appreciate every beat of your heart, balance work and rest, give and receive, your heart will always be strong enough to accompany you through every challenge. Remember, the heart is the most loyal friend, but also a silent enemy if we neglect to take care of it. And you, yourself, are the only one who can bring your heart moments of peace and vibrant beats. Let's start from today. Take time for yourself, learn to relax, keep your soul peaceful. Only then will your heart truly rest to continue accompanying you on the long journey of life.